My Lords, I should now like to repeat a statement that was made earlier by my right honourable friend, the Secretary of State for Health, in another place. With permission, I would like to make a statement on hepatitis C and HIV-infected blood. Mr. Speaker, what happened during the 1970s and 80s when thousands of patients contracted hepatitis C and HIV from NHS blood and blood products is one of the great tragedies in modern healthcare. It's desperately sad to recall that during this period the best efforts of the NHS to restore people to health actually consigned so many to a life of illness and hardship. As the current Health Secretary, and on behalf of governments extending back to the 1970s, may I begin by saying how sorry I am that this happened, and to express my deep regret for the pain and misery that many have suffered as a result. It is now almost 2 decades since the full extent of the infection was established, and 2 years since the independent inquiry led by Lord Archer of Sandwell reported. The majority of Lord Archer's recommendations are in place, as are programmes of ex gratia payments administered by the Macfarlane Trust and the Eileen Trust for the HIV infected, and the Skipton Fund for those with hepatitis C. But significant anomalies remain, and I pay tribute to Lord Archer, to other noble lords, and to honourable members from all parties for highlighting them. In October, my honourable friend, the member for Guildford, announced a review into the current support arrangements to look at reducing the differences between the hepatitis C and HIV financial support schemes, and to explore other issues raised by members during the recent backbench debate, including prescription charges and wider support for those affected. We also asked clinical experts to advise on the impact of hepatitis C infection on a person's health and quality of life, and to consider whether an increase in financial support was needed. And my honourable friend, the member for Guildford, met with representative groups to understand the impact these infections were having on people's lives. She also met many right honourable and honourable members in both houses who have been strong advocates on behalf of those affected. We've now considered the findings of the clinical expert group and accept that the needs of those with advanced liver disease from hepatitis C merit higher levels of support. At present, the amount of money paid to this group depends on the seriousness of the infection. There are 2 stages at which the Skipton Fund will make a payment. The first is when the person develops chronic hepatitis C infection. At this point, a person is eligible for a stage 1 relief payment, currently a lump sum payment of £20,000. Some may reach a second stage of developing advanced liver disease, such as cirrhosis or cancer, or requiring a liver transplant. They then become eligible for a stage 2 payment, which is currently another lump sum payment of £25,000. Under the new arrangements we will introduce, this second stage payment will increase from £25,000 to £50,000. This will apply retrospectively, so if a person has already received an initial stage 2 payment of £25,000, they will now get another £25,000 lump sum, bringing the total to £50,000. In addition to this, we will also introduce a new annual payment of £12,800 for those with hepatitis C reaching the second stage. This is the same amount as those who were infected with HIV receive. Those infected with both HIV and hepatitis C from contaminated blood will now receive 2 annual payments of £12,800 if they meet the stage 2 criteria, 1 payment for each infection, along with the respective lump sums. And all annual payments made, both to those so infected with HIV and those with hepatitis C, will now be uprated annually in line with the Consumer Prices Index to keep pace with living costs. Mr. Speaker, we know that some of those infected with HIV or hepatitis C from NHS blood and blood products face particular hardship and poverty. Those infected with HIV can already apply for additional discretionary payments from the Eileen Trust and the Macfarlane Trust. But no equivalent arrangements are in place for those infected with hepatitis C. So we will now establish a new charitable trust to make similar payments to those with hepatitis C who are in serious financial need. These payments will be available for those at all stages of their illness, based on individual circumstances. Discretionary payments will also be available to support dependents of those infected with hepatitis C, including dependents of those who have since died. Again, this will echo the arrangements in place for those infected with HIV and enable us to give more to those in greatest need. And we must also ensure that those infected through NHS blood and blood products get the right medical and psychological support. I can therefore announce two further measures. Firstly, that those infected with hepatitis C or HIV will no longer pay for their prescriptions. They will now receive the cost of an annual prescription prepayment certificate if they are currently charged for prescriptions. Secondly, the representative groups raised the issue of counselling support for those infected with blood and blood products. We fully recognise the emotional distress they experience. As a result, we will provide £300,000 over the next 3 years, allowing for around 6,000 hours of counselling to help these groups. Mr. Speaker, whilst we focus on those still living with infections, we must also recognise the bereaved families of those who have died. At present, no payment can be made to those infected with hepatitis C who passed away before the Skipton Fund was established. This is a source of understandable distress for those who survived them, and it's something we now want to put right. I can therefore announce that until the end of March 2011, there will be a window of opportunity where a posthumous claim of up to £70,000 can be made on behalf of those infected with hepatitis C who died before 29th of August 2003. A single payment of £20,000 will be available if the individual had reached the first stage of chronic infection, and another single payment of £50,000 will be made if their condition had deteriorated to the second stage, where they suffered serious liver disease or required a liver transplant. We will work with the Skipton Fund and various patient groups to publicise this new payment to those who may benefit. These new payments, which will go to the individual's estate, should help more families get the support they deserve. Mr. Speaker, taken together, these announcements represent a significant rise in the support available to those affected by this tragedy. Putting an exact figure on the package is difficult, as there is some uncertainty about how many will be eligible and how their illnesses may progress. However, we believe these new arrangements could provide from £100 to £130 million worth of additional support over the course of this Parliament. All payments will be disregarded for calculating income tax and eligibility for other state benefits, including social care. And whilst these changes only apply to those infected in England, I will be speaking to the devolved administrations to see if we can extend this across the UK. Mr. Speaker, today's announcements cannot remove the pain and distress these individuals and families have suffered over the years, but I hope these measures can at least bring some comfort, some consolation, and perhaps some closure for those affected. And I commend this statement to the House. That concludes the statement.
My Lords, can I start by wishing the Noble Lord the Minister and other Noble Lords a very happy New Year, and commend his patience. We finally got here to make the statement. I would like to welcome this statement and congratulate the Noble Lord the Minister and his colleagues on making progress, building on the work, as the Noble Lord knows, that we were trying to make in this important and tragic matter, and to which I certainly had a personal commitment. For the haemophiliac community, almost 2,000 of the 5,000 people have died in the intervening period. And for those with hepatitis C, it has become more and more urgent that the ex gratia payments should be reviewed. My Lord, this is a campaign about which we know people feel very strongly. And indeed, just as an example, one of the saddest documents I've read recently was a letter to the Prime Minister in October written on behalf of the campaign for all those infected. When 100 people travelled to London to listen to a debate, for a lobby for the day, a number of them were very sick. They included a double liver transplantee, widows, young people who'd lost their fathers, and another whose son who died only weeks before. And they felt very aggrieved by the business in the other place, which did not produce the results that they expected. And a shocked and saddened group of people struggled down the stairs from the public gallery to leave Parliament. The letter then concluded, it is not an act of Parliament that is needed, but an act of political will. And I think we've seen to an extent that that is what has happened today. Indeed, their disappointment was added to before Christmas when they were expecting the announcement that we now have before us. Can I say that I particularly welcome the extra amounts of money that are available? I particularly welcome the fact that these will not be taken account of in taxation and for the purposes of mean-tested residential social care support. But I do have some questions for clarification. The first one of these is about how money will be distributed, because the statement says that a new trust is going to be established, and I'd just like the Noble Lord the Minister to expand on how that will happen and how that money will be distributed through that trust. Will it be like the ones that exist at the moment, or are the government envisaging something new and different to do that? Because so I'd like some information about how the money will be made available and how it will be distributed. I would like some clarification on prescription charges, because the government's decision to abandon free prescription charges for people with long-term conditions obviously impacted upon the groups that we're referring to today. And I know the Minister suggested that that would be mitigated, the free prescriptions. Can the Minister clarify whether that, for example, would be those in the early stages of hepatitis C, not just stage 2? Does this cover everybody who is encompassed by the different parts of these conditions? Can the Minister, I think the areas where I feel less welcoming are the issues that have been repeated in this House on many occasions, and they're to do with the consideration of provisions that people with these conditions have about mortgages, life insurance, travel insurance, who are affected. And I can't see anything in the review that has given consideration to those matters. So I'd like to ask the Minister whether, because that actually is part of the completion and closure that is needed for this issue. And also I'd like some assurance from the Noble Lord the Minister about the support for the Hemophiliac Society, particularly since I understand that the government will be working with the Hemophiliac Society to help deliver the public information programme, the information programme that's going to be necessary among these communities to make sure that people take advantage of the benefit that the government is exploring. Final questions are a question about where the money is coming from. Where is that funding coming from? And finally, how will, if the government is successful in persuading Scotland and Wales to expand this scheme, and I very sincerely hope that they will be, how will that be funded? I mean, it seems to me that that's the question that those administrations will be addressing. But I very much welcome this, and I congratulate the Noble Lord the Minister and his colleagues for the progress they've made.
I have to answer first. My Lords, I'm heartened and very grateful for the Noble Baroness's welcome for this statement and for the package that was announced, package of support that was announced in it. We do think that it represents fair and reasonable recognition of the suffering that many of these victims endure. We wanted to recognise that, and I hope that it will be, as I've said in the statement, of some comfort to them and their families, that they will receive better support. The Noble Baroness asked me some specific questions. First of all, about the new trust, and whether and in what respects it will be different from the trusts that currently exist. I can say to her that we intend to set up the new charitable trust as quickly as possible. Its primary task will be to administer the discretionary elements of the payments that we have announced. In the meantime, the payments will begin immediately. In other words, there will be an in-year pro rata payment for the current financial year, where people are due for an annual payment, and we can proceed with that speedily, as she will see in the paper that we've published. Our advice is to those who feel that they have a claim to contact the Skipton Fund, and there will be a notice on the department's website as well to direct them appropriately. But it will be essentially a charitable trust with the kind of mandate that we've seen with the Macfarlane and the Eileen trusts and the Skipton Fund as well, but for a different cohort of people. Now, she also asked me about prescription charges. What we concluded was that whilst many of the victims of this tragedy are already in receipt of free prescriptions, there are some who are not, and we've received very vociferous representations from them and their representatives. Therefore, we will make arrangements through one of the charitable trusts, probably the new one, to pay the eligible people a sum equivalent to the cost of an annual prepayment certificate, so that in practice, all their prescriptions will be free of charge. She asked me about insurance and what consideration we had given to the requests made by campaigning groups on that score. The review highlighted to us that making provisions for access to insurance, first of all, was unlikely to represent value for money, because the administrative costs would have been enormous in comparison to the benefits obtained. But also, crucially, it would have been fraught with difficulty, including administrative complexity. I think there's no need to remind the Noble Baroness that the current fiscal context makes it even more imperative that we achieve value for money in everything that we do. And we judged that it was more important to set up a discretionary fund where, if necessary, people who were in particular hardship could look for additional support and perhaps fund insurance premiums from that support. But an across-the-board arrangement for insurance, as will be apparent from the report that we've published, and we took advice on this, I should tell her, from the ABI and various specialist insurers. An across-the-board arrangement it ruled itself out for a number of reasons. She asked about support for the Hemophilia Society. We intend that to continue. She asked where the money is coming from. There will be a significant immediate cost to the departmental budget during this current year. We have found savings in our current expenditure for this year, which enables us to make room for these payments, I'm pleased to say, and we've had that in mind for some considerable time. I'm pleased it's come to fruition. And in future years, we have found room in our central budgets for the ongoing annual payments. As regards Scotland, Wales and Northern Ireland, it would have been obviously preferable if there could have been a UK-wide announcement. Clearly, it is not for us to prescribe to the devolved administrations what they should do. However, as I indicated, we are talking to them actively, and it is up to them to consider whether this is something they wish to do for those infected in hospitals in the various devolved regions.
Sorry. My Lords, I have two interests to declare. Not pecuniary. First, as President of the Hemophilia Society and as the architect of the independent public inquiry into the contaminated blood disaster headed by my noble and learned friend, Lord Archer of Sandwell. Is the Minister aware that of the 1,241 haemophilia patients infected with HIV, only 361, 29%, are still alive, and that the number of deaths in the haemophilia community is now over 2,000. It is estimated to be 2007. My Lords, I'm sorry. Yeah. Sorry, I've got a...
You okay?
Yeah, let's sit down. Sorry.
You're okay?
I'll sit down.
You're all right.
I'm sorry about that.
You're all right. You're all right.
Yes, not too bad. Yeah. So, is he aware that of the 1,241 haemophilia patients infected with HIV, only 361, 29%, are still alive, and that the number of deaths in the haemophilia from haemophilia C infected community is much higher and still increasing? Is he further aware that as of now an estimated 2,007 people have died from being treated with contaminated NHS blood and blood products? While congratulating my noble friend on the progress he's made, will he now meet the haemophilia community and listen again to their plea for a response more in keeping with the scale of the disaster? Sorry.
My Lords, the noble Lord Morris of Manchester, to whose efforts I pay particular tribute in the context of this debate, as in many other contexts, has reminded us of the devastating effect of this tragedy on individuals and families. The last government recognised this, significantly improved the payments that were available to the victims of this disaster. We felt there was still further to go, hence today's statement. We have arrived at this point following a brief but nevertheless thorough review of the arrangements, informed by a scientific report which is also published today, and the noble lords can read that, the advice that we received, to enable us to understand rather better the suffering that these victims endure in clinical terms as well as in human terms. And on the basis of that, we have arrived at the arrangements that I have repeated. My Lords, we believe that this is a fair and reasonable package of support for these poor victims. We don't intend to revisit it in the future. Now, I acknowledge that some people might have different views on the appropriate level of payments for this patient group, but the package does need to be considered in the context of the whole range of support that's available for the group, especially Department of Work and Pensions benefits, the care available under the NHS, the care available from social services. Having consulted widely, we consider that the sums announced in this package, taken in the round with the other support available to this patient group, are both appropriate and reasonable. So, whilst I understand the Noble Lord's request, I'm not in a position to accede to it at this point.
My Lords. Oh.
These benches. Sorry. On you go.
Thank you. My Lords, first of all, I'd like to congratulate my noble friend, the Minister, on this package and the statement today. We very much welcome it, and the huge progress that's been made, as has already been said by noble lady on the opposition. Given the commitment made just last October into the review of the current arrangements, I think, he's to be congratulated for the swift way that this has come back to this House, to the Lordship's House now. And I hope it does serve to bring some comfort for those who have campaigned for so many years for justice, particularly those relatives of the bereaved, and hopefully it will help to bring some comfort to the many victims of this tragic episode. I've got a couple of questions to ask my noble friend. With the posthumous claims, it says that there's what you announced that there was a window until the end of March 2011, which is some 6 weeks away. I think there are concerns after years and years of campaigning that it's not really a very big window and not a lot of time for some people to be located, and for many people who may need assistance to put together their claim. So perhaps the Minister could say something about why there's such a short window, and is that sufficient, really? Is he satisfied that that would be sufficient to try to track down as many people as possible who may have lost out? And the second point I did want to make was about just a bit more to elaborate, if the Minister could elaborate on the posthumous claims. Will this receiving posthumous claims, the co-infected, will the widows, partners, children, will they be included in that? Can we just it's not quite clear from the statement who is included in that, in who will receive those posthumous payments. So I'd really appreciate some clarification on those points.
I'm very grateful to my noble friend. The window of opportunity referred to in the statement until the end of March, which is best part of 3 months almost, is we should be sufficient in our judgment to enable those with a valid claim to come forward. On the whole, we believe that in the haemophiliac community, the victims' families know who they are. There is more difficulty, I will acknowledge, with those who were in receipt of whole blood. But again, we believe that the victims and their families know, the victims' families know who those individuals were as well. And our job now, I think, is to publicise these arrangements so that the families are aware of the support currently available to them. We think the window is sufficient. On the question of posthumous claims and who is to be included in those claims, we are saying that there will be one claim considered per deceased estate. Now, it may be that the deceased person left his or her estate to a spouse, or indeed to charity. But whoever it is, whoever was the beneficiary of that estate, is the person entitled to come forward to claim the money. So we will deal with claims on the basis that the validity of the claim is proven in relation to the estate of the deceased person, and that is a matter of public record.
While thanking the Noble Earl for his statement and recognising his readiness to listen and act on representations, could he also recognise the work of a vast number of people of all political parties and none who have worked assiduously for a very long time to ensure that there is financial relief of a proper order available to those who have suffered from the tragedy and their dependents. May I also, if I'm in order, Lords, pay tribute to the work of my noble friend Baroness Thornton, who throughout this has shown a ready ear and a sympathy for those who are affected. And of course, may I pay tribute to my noble friend Lord Morris, who has been worked tirelessly throughout so many years. My Lords, may I congratulate the Government on addressing one very important anomaly, which is that suffered by the dependents of deceased members, the recipients of the Skipton Fund. But do I take it that that is the only anomaly that the Government are proposing to address, or will their ears be open throughout the discussions to some of the other anomalies which have been uncovered? While grateful for the increased benefits, can he explain why it is that they are now to be paid as before through charitable trusts and not directly from government offices as a direct entitlement of the beneficiary? There may be very good reasons for this, but so far as I'm aware, they've never actually been given. And finally, since this was in the form of a statement, does that foreclose further discussion on what is to be done, or will there continue to be discussions about the proposals during their progress through Parliament and into the future?
My Lords, the noble and learned Lord Archer is himself to be thanked and congratulated for the immense amount of work that he did to inform the thinking of the previous government and indeed the current government in these matters. And I immediately echo his tribute to the work of so many people who enabled us to gain a proper understanding of these issues, of, as he said, all political parties and none. And also, if I may say, to the noble Baroness Lady Thornton, who I am well aware was working very hard up to the last election to see whether a better package could be delivered. And so I was particularly pleased to hear her support for this series of announcements. The noble and learned Lord asked me about the benefits for deceased victims and whether these were the only anomaly that we sought to correct. I think we identified two principal anomalies in the situation that has obtained hitherto. One was the one to which he referred in relation to those who died prior to the 29th of August 2003, which was an arbitrary cut-off date. The second was the clear imbalance of benefit for those who suffer hepatitis C as a result of receipt of contaminated blood. There was a gap to be filled there, and we were even more clear on that, having read the scientific report that we received. What we have therefore sought to do is to redress that particular balance. There are, as I've referred to a number of other new elements in the package, but I think I've identified the two main ones that stood out to us. He asked why we were choosing to use as the mechanism for payment a charitable trust. I think we feel that the arrangements have worked very well so far through charitable trusts. We don't think it's appropriate for these benefits to be paid through the Department of Work and Pensions. It's not really within their remit to do this. They are there to pay benefits, and they're certainly not there to decide on discretionary payments. We hope and believe that the victims who are in receipt of benefits currently have good relationships with the trustees of all the funds. As regards further discussion, I think, as regards in connection with the practical arrangements for paying these new sums, if there are queries, we will endeavour to answer those. As I have indicated, we are directing people towards the Skipton Fund as the point of information on this. But we do think that the package that I have announced today and my right honourable friends announced should be regarded as the final one, because we believe that it does settle the outstanding issues that we needed to address.
I thank the Minister and welcome his statement today. As a former Home Health Secretary, I took some interest in this matter, though in recent years I, like the Minister, would like to congratulate my colleagues who have been involved in this. The one thing I did come to understand is this was not only an intractable problem in a sense, but it was an increasingly intractable problem for two reasons. One was that as time passed, the human tragedy of the people afflicted became more and more obvious, and secondly, the scientific evidence became more and more complicated and difficult for the government to avoid. So I do thank the Minister for this. Two quick questions, really. The first is, would he accept that if, having finally come to a stage that may not be completely the end and may not be completely satisfactory, but is much fairer than was previously, that there is a disparity between Scotland, England and Wales in terms of treatment of the victims here, it will detract greatly from any value that this is given if there seems to be an inequality and unfairness. And secondly, as my friend and colleague, the Noble Lord Morris, said, that although this goes a long way, there may still be outstanding issues here, and will he not close the door completely to further discussions which could arise in the light of further scientific evidence?
My Lords, I'm very grateful to the Noble Lord who comes to this with a very considerable knowledge and experience as former Secretary of State for Health. He's right. It has been a very difficult, if not intractable, problem for successive Secretaries of State. And he's also right to say that the human tragedy has become more and more obvious as the years have passed. And for one thing, I don't think it was obvious in the early days that there would be so many victims of hepatitis C, because that is a condition that only tends to emerge after a considerable lapse of time. The HIV infection was, of course, more immediate and therefore more obvious. He is, of course, right that in making this announcement for England, we are creating an immediate disparity with the devolved administrations. As I've indicated, I hope that in our discussions with the devolved administrations, who are, after all, autonomous, we can arrive at a more equitable package for all victims across the United Kingdom. I'm sure, without wishing to appear to interfere in the affairs of the devolved administrations, that is something which as human beings we would like to see. But I cannot preempt the decisions that will be taken in those administrations.
My Lords, I'd like to declare an interest as the Vice President of the Hemophilia Society. I would like to say I'm very pleased that the Government have recognised the plight of so many people and families who have suffered this disaster. But I'd like to ask the Minister what safeguards are in place to prevent any infections from blood transfusions or blood products happening in the future. Prevention is so important, and one never knows what is on the horizon.
My Lords, the noble Baroness is, as always, absolutely on the mark, and this is something that has been a very important issue, not just for the current government, but the previous one. Since the mid-1980s, the measures in place to assure the safety and quality of human blood and blood components and blood products manufactured from them have developed very significantly. We test for viral markers. The donations contribute to a plasma pool, which is also tested for viral markers. In 1985, the introduction of heat treatment in the UK removed the risk of both HIV and of hepatitis from blood products. Testing of all donations for HIV was also introduced in 1985. Testing for Hep C was introduced in 1991, when tests became available. The European Directive is now in force. As of 2002, it sets standards of quality and safety for the collection, testing, processing, storage and distribution of human blood and blood components. We have a community code for medicinal products which affects blood products such as clotting factors. And upon completion of manufacture, blood products are tested for compliance with specification by the manufacturer, and all batches of blood products undergo independent testing by an EU official medicines control laboratory. So we are in a different world entirely now from the world of the 1970s and 80s, and I hope that reassures the noble Baroness.
My Lords, I'm very sorry, but we are out of time.